Okay, just waiting for the last minute people that usually chime in and start watching. Typically, these webinars start at 12:15 Eastern Daylight Time, excuse me, which I guess is a little bit different if you're in South Africa, like Hannah Lee is, or in Houston, Texas, or other geographical areas. But remember, these webinars are always recorded and uploaded to our website. And also you'll be sent a link to watch it again. So register for them, even if you cannot watch live, because then you'll just get a link into your inbox for the webinar. Alternatively, you can always just check the webinars on our website as well too. Watching live, I think, is better because you have a chance to ask me questions and it's a bit more interactive as well. So I'd like to introduce myself. My name is Dr. David Kanashko. I'm the medical director at BioFlex Laser Therapy based in Toronto, Ontario, Canada. And I'm a licensed chiropractor for over 30 years, also acupuncturist and other types of techniques over the years. And I've been working with laser therapy or photobiomodulation therapy for over a decade now. And those of you who are new to watching these webinars, I do 2 webinars a month. One is geared more towards our consumer level devices, our personal therapy devices, so more for a consumer. And the other type of webinar I do is for our professional laser devices, more for healthcare professionals, but anyone can watch either of them. It doesn't really matter. I think they're informative, but obviously the language and the content may differ a little bit when I'm focusing towards, say, another healthcare professional. But end of the day, I think the information is still pretty relevant and useful to both sides for sure. Another thing too is that you can ask me questions as we go along. I prefer if you ask me the questions in the Q&A box. So type them in as we go along and I'll answer them. I'll answer them typically at the end of the webinar. So just be sure to type them in. And there's time at the end to type in questions as well. Try to keep it to the topic if possible. Sometimes I get all sorts of other questions and that's fine, but I'm more specific today talking about shoulder pain or shoulder issues, and that's the main focus of today's topic as well. And I hope to be starting in October a monthly podcast as well on light therapy, which will be a little bit different format. Obviously, it'll be a podcast, and I'll be interviewing experts in the field and talking more about light therapy. It's become very popular, as many of you know, and that's probably why you're watching or tuning in as well. A little bit about our company, BioFlex. We've been in the business of laser therapy, light therapy for over 30 years, probably the oldest manufacturer in North America. And we have a strong clinical history because our company was founded by a vascular surgeon, Dr. Fred Kahn, and we still operate a very large outpatient clinic based in Toronto as well. So even though we're a manufacturer of medical devices, we're actually all clinicians and we use the equipment on real patients and we do clinical trials, case studies to really figure out what's going on with this light, as opposed to a manufacturer that, buys them from, let's say overseas somewhere, and then just markets them and makes claims. A little bit different scenario than what we do. Everything that we make is actually manufactured and made in Canada, just so you know. If you haven't already, let me know where you're from, your name, if you use BioFlex, if this is the first time listening in, and certainly if you have any other questions for me. So the format is I'm going to go over these personal systems very quickly, what they are and sort of how they work, what photobiomodulation or sometimes you've heard is cold laser therapy, or there's different terminologies for it, but the best term is photobiomodulation. And then I'll go and do a little review depending on if you know anatomy or not. I'll discuss shoulder anatomy and the structures that we're going to be talking about that cause pain in your shoulder, which is a really common issue, and I'll talk about that as well. And then I'll talk specifically about how you would use our device for treating these different common conditions. And then, of course, we'll have time for Q&A. So once again, if you have any questions, that's great. Type them into the Q&A box, and I'll answer those at the very end of today's webinar. So we've been manufacturing, by the way, we started off making only healthcare professional grade devices, and we saw the need for patients that had finished treatment at our clinic or other clinics. They wanted to continue treatment of their, say, arthritis or other issues from the confines of their home, for traveling, you know, at the cottage, wherever you might be. And so we developed a consumer device that's based on our professional devices, very, very similar with respect to the specifications and so forth. There's a few differences, the software, the ability to customize the specific parameters. And of course, we cannot sell legally, and nor should you be buying a Class 3B laser. That is a restricted device because you can damage your eye and you can do some other things that you would regret unless you actually had proper training and were a healthcare professional. That being said, you don't need a laser for light to be therapeutic, and that's why the name is not laser therapy anymore. It's photobiomodulation therapy. Our devices are the only ones to have bicolor superluminous diodes. That's a hybrid between an LED and a laser diode. It's incoherent light. It's not a coherent light like a laser, but it's a narrow band, meaning that the light is very, very specific to the wavelengths that we're after, which is red around 660 nanometers and near infrared around 830, 840 nanometers. Each diode emits two wavelengths, first red, then near infrared, which is really important. So these diodes, when you look at them, they protrude out of our equipment. And the idea there is that they push into your skin. Light therapy works best when it's contacting the diodes or as close as possible and touching the skin. I do not advocate the use of anything that doesn't touch the skin, because up to 85%, even higher, of light reflects off the skin, right? So the purpose is not to treat the skin. Well, I mean, if you're treating skin conditions, sure, but you want to go through the epidermis, through the dermis, through the subcutaneous tissue, into the muscle, the tendon, and the ligaments. And if you want to do that, you need to make sure the diodes are exposed and touching the skin. And you also notice that our equipment, the diodes are very, very, very close together. There's some similar equipment out there being sold on the internet. And if you look at them, they're spaced extremely widely apart. The engineering isn't very good, which is why they have to space them so far apart. And they don't use bicolor diodes. So you have a red, then a near infrared, and a red, and they don't protrude out. So there's many differences between competitors that look similar. So if you're not quite sure, you certainly can shoot us an email or give us a call, and we can explain the differences as well. The controller looks something like this. Of course, today we're interested in the shoulder. So that is the protocol that you would actually be using for today's treatment sessions. And the controller is quite easy to use. There's a power button. There's a stop, which completely stops your treatment. There's a pause button and a play button. So if you want to turn it on or pause, you can do that. And then there's a stage or level of intensity, 1 through 4. And that's just not power. It's also pulses of light. And I won't get into it this webinar, but pulses of light and how it's pulsed out can be very effective. And that's part of the research and the work that we've done for 3 decades, is to try and understand why these pulses are effective and what pulses are effective. And we put that into our protocols. So that's a big part of our equipment as well. The definition of this type of light therapy or photobiomodulation, according to the World Association and the North American Association for Photobiomodulation is it's a form of light therapy that uses non-ionizing forms of light. Ionizing is like X-rays and ultraviolet. They're very damaging. Non-ionizing are like radio waves and infrared and visible spectrum. And so you can use a laser, you can use LEDs, you could use broadband light like intense fluorescent bulbs, and it has to be in the visible and the near infrared spectrum. It's a non-thermal process. You shouldn't feel much heat. You may feel a little bit of ambient heat. That's okay, but you shouldn't be hot. That's not the purpose of this this type of therapy. It's not meant as a thermal, heat pad type of therapy. Even though there is a bit of mild heat, that's true, and that's of course helpful to some degree. But the purpose of it is actually what the light does when it gets absorbed into the cells. And so when that happens with the right dosaging and the right pulses, it can actually help the cells recover from inflammation and injury. Therefore, you'll have less pain, less inflammation, obviously. It has a role to play in wound healing and tissue regeneration and other positive effects on an injury or progressive disorder like a osteoarthritis or what have you. So that's in a nutshell what this is doing. Let's get into shoulder pain. Shoulder pain is very common with an estimated prevalence of anywhere from 4 to 26%, even though I found wide ranges up to 50%, but I'm going to say roughly 25% of the general population are having shoulder pain at any given time. So it is very common because there's so many things that can cause shoulder pain. It's the third most common cause of musculoskeletal consultation in primary care. In other words, when you go to see your chiropractor, your physiotherapist, or your medical doctor, and you're talking about muscles or joints pain, shoulder is number 3 on that list. And you can imagine what the other top 2 are, I believe, are knee and back. So it's very common kind of condition. And I'm assuming some of you might have had this problem, which is probably why you're tuning in and watching now. So let's talk about the bones, the skeletal structure. There's 3 main bones that we should be concerned with: the humerus, which is your big arm bone, the clavicle, which is sometimes called the collarbone, and the scapula, which is like the winged portion of your shoulder as well. And you can see all the different connections there. The actual connections or joints, you can see there's quite a few. There's the acromioclavicular joint, which is the connection between the collarbone or clavicle and the acromion of the scapula. There's a glenohumeral joint, which is the large shoulder joint. If you're a fan of baseball, you might know that one of the I think it was, I forget his pitcher, Mesa, maybe, I can't remember the name of the pitcher, but he dislocated his glenohumeral joint while trying to tag out someone coming to home plate. And he was actually back playing within 3 weeks. Now, I don't know if he used BioFlex laser therapy, but I will say this: if you're a football fan, tonight's game between Buffalo Bills and the LA Rams, the LA Rams won the Super Bowl last year, and their quarterback, which has been having ongoing elbow issues, is using BioFlex, a personal system, and their trainers and so forth are starting to gravitate to our equipment. So unfortunately, I'm a Bills fan. I hope that QB, plays well, but not well enough to beat Buffalo. Anyway, I digress. You can also see other joints, including the sternoclavicular joint, which is a connection at your sternum between the clavicle and the sternum as well. So it's quite a complex joint, joints in around this area. I mentioned several already: the glenohumeral, the acromioclavicular, the sternoclavicular. And there's something called the scapulothoracic joint, which is not a true joint, but it's the sort of the way that your shoulder blade rubs against your thorax. And that in itself, because there's movement, is considered a joint, but it's not a typical joint that you would think of as far as joint capsule and fluid and all that kind of stuff, but it is sometimes referred to as a joint as well. Lots of different muscles. If we look at the back of the shoulder, you can see here, those are the rotator cuff muscles, supraspinatus, which is probably one of the most common causes of shoulder pain, infraspinatus, and teres minor. They all come together to join at a common tendon, which is referred to as the rotator cuff tendon, along with the subscapularis on the right, which is a front view of your shoulder. And you can see them all sort of coming in. It doesn't do a great job of showing that they actually all connect together into the shoulder as well. The actual glenohumeral joint, you can see at the bottom picture here, is a shallow ball and socket joint. It's shallow because there's not much fossa or depression for the head of the humerus to sit in it. Hence, dislocations like that picture I mentioned are very common. And some of you may have had a dislocation before. Typically, it pops back into position. There is an area that a weakness in the capsule that it can pop in and out with some trauma, and usually you get pretty complete healing, so it's not a major problem. One of the muscles that does cause shoulder pain is the biceps muscle, or biceps brachii muscle, specifically the long tendon shown on the far left through here. And I'll talk a little bit about bicipital tendonitis shortly. And of course, there's a bursa, several bursa, but the one that we're most concerned about is called the subacromial bursa, which lies between the acromion, which is a tip of the shoulder, and the rotator cuff tendon. And you can see here it lies right in between those two structures to reduce friction when you move your shoulder around. If you do a lot of overhead work like painting or cutting hedges or whatever it is, and then you start to get some shoulder pain, it's usually because this bursa or that area is being irritated. Bursa are little fluid-filled sacs that reduce friction upon movement, but they're meant only to reduce friction in a short time frame, not if you're doing excessive work for too long, and then you can start to get problems like shoulder impingement syndrome that I'll talk about shortly. Well, look at this. There's lots of different causes of shoulder pain. Bursitis, clavicle injury, like a fracture or separation. There's rotator cuff tears. There's lesions of the labrum of the cartilage inside the joint. There's tendonitis. There's nerve pain coming from the neck. There's acromioclavicular joint injury. I mentioned like a separation. There can be tendonitis at the supraspinatus. Heart attacks can cause what's perceived as shoulder pain. Well, oftentimes the doctors, people coming in to emerge saying they're having shoulder pain and arm pain, thinking it's a shoulder problem, but they're having a heart attack. So these are all causes. I'm not going to go into all of these. I'm going to go over the most common ones, but you can see there's lots of causes. If you look at the back of the shoulder, there's even more potential problems. Again, everything from the ones I've mentioned to muscular issues, trigger points, neck strain because the neck muscles come out and attach to the shoulder area. The lungs can refer problems, even the gallbladder. I don't know if it's there or not, but if you have gallbladder irritation, it can refer pain to the back of the shoulder as well. So number one thing here is if you have shoulder pain, get it checked out. And get a good diagnosis, because the last thing you want is to have a serious problem and not have it looked after. Okay, let's talk about some of these more common conditions. Rotator cuff, we all know about this. These tend to be fairly common in the age group from the 30s all the way up to your 70s and beyond. There can be tendinopathies, which is an issue with the tendon itself. And usually it's due to repetitive movements, again, especially above shoulder level. It doesn't always have to be related to that kind of work, but usually it is. And even though it's most common in the dominant arm, it can often times occur in the non-dominant arm. And even if you're not doing manual type of labor or that kind of mechanism, you can still develop it, especially as you get older, which tends to be more of a tendinosis condition, which is degeneration. As you get older, things dry up, things shrivel. Sounds fun to get old, right? And unfortunately, the tendons do that as well, and then they become problematic. Whereas tendonitis is where you've actually done something quite vigorous, sporting, athletic, or work around the house, or something to do with work, and then you develop an acute inflammatory process because of a direct injury process. There is some evidence to suggest that hereditary or genetic susceptibility can also cause people to be more prone to this problem as well. So if your mother, father, or grandparents had lots of shoulder problems, maybe there's a link there as well. So rotator cuff tear is a little bit different scenario. Usually it's traumatic. It can occur in both the young and as you age as well. In more elderly patients, it's usually attributed to bony spurs and degeneration around the acromion and the rotator cuff itself. In younger people, it's more with something traumatic, as I mentioned, like sports or activities or what have you. Location for the pain is usually in the front of the shoulder. So, you know, if you're looking at me right now, it's this in this general area here. It's not usually on the top. It can sometimes be in the back as well, over the whole shoulder, but usually a person will complain of it radiating out to the front area of that shoulder. That's usually where the pain is, but the problem isn't there. It's actually towards the back and deeper down. Problems with the glenohumeral joint, or the actual shoulder joint, one of the more common conditions that can occur is called frozen shoulder, or the medical term is adhesive capsulitis. You tend to see these in a little bit older individuals. Usually the median age for this condition is in the 50s. Oftentimes you also get other conditions in this joint, like osteoarthritis, and usually you're a little bit older for that scenario. In frozen shoulder, you can see the joint capsule gets red and inflamed and contracts. And because it contracts, you suddenly lose arm movement. Like literally, you cannot move your arm very much at all. And there's 3 stages of development that each stage can be several months long. So this condition can last up to a year or even longer. And slowly you get your movement back, but you need to be doing exercises and really working with someone, or at least know what you're doing to get movement back. Because if you just sit there and baby it and don't do anything, this is going to take much longer, and you may have limited mobility afterwards. So make sure that you get it taken care of initially as well. It tends to be more common in people with diabetes as well, or after prolonged immobilization. So maybe you hurt your elbow or something else, and you're in a sling for a few months or whatever, or a few weeks or whatever the case may be. And then you might develop frozen shoulder because you haven't been moving your shoulder around. So one has to be aware of that as well. Now, for osteoarthritis, this occurs in the hyaline cartilage. You get degradation of the joint surfaces, both on the head of the humerus in the first circle and in the hyaline cartilage of the fossa, which is a depression in the scapula as well. So these areas start to degrade, like everything else, and then you start to get inflammation and pain deep inside of the joint. Now, another common cause of shoulder pain is impingement. So impingement is essentially what it sounds like, and it's not fun, is normally what happens is you get I don't know if you saw that picture or not, when you lift your arm up, the tendon contracts, and there's a space between it, and you can see this bony bump here. That's the acromion, and just underneath that, not shown, is a bursa. There's very little room for error here when you're moving that. So right now, if everyone who's watching, lift your arms and go all the way up and try and touch. If you feel some pain, especially as you get up to the end point up through here, you may have a bit of impingement going on. So essentially what's happening is you get swelling because of repetitive movements or degeneration, especially in the bursa or the rotator cuff tendon itself. And then now you have less room for this I don't know if you can see it here or not. I tried to point, good job, Dave. I tried to show you here this big bump here, I call it greater tubercle. It actually rides underneath that acromion as well. So very little space there. And if there's swelling in through there for some of these tissues, you're going to feel it. So that's impingement syndrome. And it's a vicious cycle, essentially, because what happens is further rubbing results in more edema or swelling, and then even less space to work with. So you have to be really careful to minimize the movements that are aggravating the condition. As I mentioned, bony spurs can also cause that. The spurs can occur because of repetitive use of the tendons over time. So that's going to occur more in the elderly patients as well. And that takes up space in that area as well and can lead to impingement. Sometimes that might require surgery to resolve. Some other causes include calcification of the rotator cuff tendon. Sometimes that's called calcific tendonitis. Nasty, 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 nasty condition that is really painful, especially at night. And it's painful when the body's resorbing the calcium, which doesn't make intuitive sense because it sounds like that's getting better, but that's when it's the most painful. Laser therapy does not break up calcium, but it can reduce the inflammation and the swelling in that area. This is a really common condition, and usually you would need some imaging like ultrasound or MRI to get a really proper diagnosis in the area. And as I mentioned earlier, you can get inflamed bursa, especially this subacromial bursa that can lead to impingement syndrome as well. Usually there's multiple things going on here that causes shoulder impingement. Not a very fun condition to have. Another condition that is maybe not as common, but bicipital tendonitis. If you look at the biceps muscle, it's quite interesting. Biceps, meaning two muscle heads, and each muscle head originates from two different locations on the scapula. And now, if you follow the tendons, the one on the far left that has that red, ugly-looking inflammatory section, that's the long head of biceps, and it sits in a groove, a bicipital groove of the humerus. The short head, you can see here, attaches to something called the coracoid process of the scapula. It's usually the long head that gets inflamed due to repetitive use sometimes, or degeneration of the tendon, and the tendon sheath and or tendon itself become inflamed in this groove. It can also be caused by anatomical abnormalities and other things as well, but it's really easy to diagnose because as soon as if you know how to palpate the bicipital groove and the tendon on your shoulder and you push right in there, if it's screaming and it hurts, it's probably bicipital tendonitis. You got to rest these conditions and let them get better. But of course, treating, whoops, I don't know what happened there. Treating them right away is really important as well. Okay, let's move on to, wow, I should maybe have 45-minute webinars because it's a lot of information. Okay, BioFlex approach. The purpose of our equipment is to drive light both superficially and deep. You might say, well, why superficially? The reason for superficial red light therapy is that it targets pain receptors in the blood, and this has a beneficial effect of both reducing inflammation in the blood circulation around the area that you have a problem and reducing pain. When you drive light even deeper with near infrared, that actually is absorbed by the deeper structures like we've been talking about to help them heal directly. So using the combination of the two is really helpful for all three things: pain relief, reduction of inflammation, and tissue healing. If you just use red, you're going to get pain relief and some anti-inflammation, but you're not going to get tissue healing directly. If you just use infrared, you limit the amount of pain relief and anti-inflammatory effects. So using the two in combination is much better than just doing one or the other, which is, again, why the whole thing with red light therapy and so on and so forth, there's lots of holes you might see in their discussion about how it's used. And I did a webinar last time on that, so you can watch that as well. Our goals of treatment for using our equipment obviously is decreasing pain and inflammation, accelerating the healing process, and reducing swelling. So of course, it's also going to promote increased circulation as well. Of course, we're using the shoulder protocol for treatment. So rotator cuff, excuse me, just getting over a cold, not COVID, but some stupid cold. For rotator cuff conditions, you want to apply the light pad or the light array in 3 specific areas. One is in the front of your shoulder, overlying the anterior aspect of the shoulder, one on the side, and one over the back of the tendon as well. So here's the front of the shoulder. Here's the side of the shoulder. Notice in the, whoops, let me back that up. Let me try that again. Okay, notice for the side of the shoulder, you want to have the pad. Now, I didn't really show it's bent, but you want to have it, if you look at me, you want to have it curled over the shoulder so that at the very top of the shoulder where my finger is right here, that's the supraspinous fossa. You want the light over that area, and then you want to bend over the side of the area to access the subacromial space. And that portion of the tendon as well. And then the last position is the back of the shoulder. And there you want it to overlie the insertion of the rotator cuff tendon, which lies sort of, it's sort of right where my finger is here, right around the back. You feel a depression or like a muscular area at the side of your shoulder, and that's where you're targeting the light for there. So those would be the locations for rotator cuff. If it's a tendonitis, meaning an acute inflammatory condition, then you want to treat, it tends to resolve fairly quickly. By quickly, I mean several weeks to a couple months. That's pretty quick for a tendon. If it's degenerative, meaning that it's an ongoing problem, then it can take many months to resolve and maybe not completely as well. Whereas a tear will take even longer. So understanding what it is you're dealing with will give you an idea how long it's going to take to get better. If it's a complete tear, an absolute complete tear, and it's found quick enough, they can do surgery to repair it. Oftentimes, they can't do surgery. Treatment initially 4 to 7, 8 days in a row when you have acute symptoms at level 1. And then you can follow up by treating maybe every other day, up to 4 to 6 sessions a week, thereabouts. It's a little bit less frequent per week. If you're feeling like your recovery is slowing down, plateauing, or perhaps you're not feeling a lot of changes, then you can go to level 2 and give it some time as well before moving it to the next specific level. Again, consult with a rehab health professional to get an accurate diagnosis. Maybe you need some imaging so you can understand what it is you're dealing with. Again, treatment levels and sessions, as I mentioned earlier, treat every day if it's acute. Otherwise, you can start treating every other day. For things like a frozen shoulder, you're going to treat in 4 positions. You're going to treat in the front of the shoulder. You're going to treat in the side of the shoulder, and you're going to treat in the back of the shoulder, like so. And the 4th treatment is in the armpit or the axillary region. And what you want to do there, if you look at me right now, is you want to lift your arm up as much as you can. You may not get to 90, but maybe only 20 or 30 degrees. Rest it comfortably on a pillow. So make sure that it's not in a painful position. Like you may not be able to get it this high. And then place the 4th placement, the light array, in the axilla. These bend nice and easily. You can curl it and put it right into your axilla. I might suggest that you put some saran wrap or plastic wrap over the pad for hygiene purposes. And remember that you should always be washing and cleaning the surface of the array with a very light antiseptic or low percent alcohol solution, just to keep it hygienic as well. So frozen shoulder, 4 positions. Frozen shoulder can take a long time to heal, as I mentioned earlier. If it's in the acute stage, treat every day, maybe even longer than 4 to 7 days if it's really acute, and then go to 4 to 6 sessions per week. Again, start at level 1 and keep at level 1 for some time before you move on to level 2. It takes time. This light isn't designed to give you instantaneous pain relief. That's not the purpose of it. Although sometimes you do feel better right after the treatment. The purpose is healing and prolonged anti-inflammatory effects. It's not meant like a Dr. Ho where you put it on and go, oh, I feel great for 5 minutes, and then it does nothing. A little sarcasm there. Other conditions like osteoarthritis of the glenohumeral joint, similar to rotator cuff, 3 positions in the front, in the side, and in the back as well. Just as I mentioned earlier, you want to cover around the entire joint. You don't really need to do the auxiliary one for osteoarthritis, but if you have time and you want to, it doesn't hurt. But typically 3 positions is pretty good for that. Remember, osteoarthritis is a progressive disorder. It's not going to be healed and it's not going to go away anytime soon. But your goal here is to manage the symptoms along with other therapy or techniques like stretching and other rehabilitation, things that your physio or your chiropractor or massage therapist can do as well. Again, make sure you see a healthcare professional. If you have arthritis, I would get an x-ray just to confirm the extent of the degeneration as well. Similar treatment plan. If you're having a lot of acute pain, treat every day. If it's subacute or more kind of chronic, you can treat every other day or thereabouts. Once you plateau, go up to the next level. Okay, my throat's really starting to bug me now. Shoulder impingement. Typically, 2 positions is good for shoulder impingement, in the front of the shoulder and the side of the shoulder overlying the acromion or the point of the shoulder. The idea here is to get light underneath the tip of the shoulder into the subacromial space, and the front and the side positions are the best spots to treat a shoulder impingement. And again, I'm always going to harp is that these conditions, especially like impingement, because there's multiple causes, can take some time to get better. Consult with a professional if you can to get an accurate diagnosis always, to understand the severity of the condition. Sorry, that should say impingement. And similarly, if really acute, really painful, you can treat every day. Otherwise, you're going to treat every other day or up to 4 to 5, 6 times a week. Progressing the levels as well, but do it slowly and be patient. If you've always gone to stage 4 and it's plateauing, give it a break for a few days and then go back to stage 1. Bicipital tendonitis is pretty easy to treat. You just place the pad over the front of the biceps, over the area. Whoops. Let me back up a bit. Over the biceps tendon at the front of the shoulder. So usually just one placement is necessary for bicipital tendonitis. Again, biceps tendonitis, if it's acute and it's a true tendonitis, it should resolve within a few weeks, 3, 4, 5 weeks, 6 weeks or so. Make sure you rest it appropriately as well. And I'm going to sound like a broken record. If it's really acute, which tendonitis tends to be, treat it every day. And then as it's getting better, you can take a little bit more breaks and treat every other day as well. So let's review how you're treating the shoulder. Remember, always start at level 1 The reason for this is that it seems to be the most effective initial protocol to use. If you go right to 4, that might be a little too much, and you may not get the results that you're looking for. So be progressive with that and wait and be patient before you start moving to the different levels. If you feel your symptoms are improving, then you go to the next stage. If you're not improving and you haven't consulted with a healthcare professional, consult with one. You need to know what you're dealing with. If it's not working for you, then it's probably because you're not using it right, or you don't know what you're treating, that kind of information. I've been offering clinical support now for years for this consumer device. I think I can count on one hand people saying that it hasn't helped them. And on that one hand, those patients, there were probably reasons for that, that it wasn't working for them. So this really does help, but you just have to know how to use it and when to use it and why to use it, like anything else. If you feel your symptoms aren't improving, then again, make sure you're getting the accurate diagnosis. Don't advance the stages too quickly. Make sure you're not aggravating your problem. Let's say you treat it for a few days, you go, wow, I'm feeling really good. And then you go out and play badminton or I don't know, try and do whatever you want overhead, and then you start aggravating your shoulder. And so that's not good. So make sure that you complete your course of treatment. And as I mentioned earlier, whenever you're dealing with an acute scenario, you can treat every day. Generally speaking, after you're getting around 50% improvement, you can go down to twice a week. And then once you're at 80, 90% better, you can just tailor it down to once or twice a week as well. If you're dealing with a progressive issue like arthritis, you may want to treat it once a week. Ongoing, maybe sometimes twice a week, depending, but you do want to continue to treat and not just stop treatment, period, because that will slow the progression down of the arthritis. So the big picture here is ensure you know what you're dealing with. Make sure you know what's causing the problem, right? Make sure you're not aggravating the condition, but you want to keep the area moving, which is a fine line there, because movement's really good, but too much movement or specific activities, especially in the shoulder, might aggravate the condition. Be patient. These conditions, especially tendons and bursae, take a long time to heal. Not a fan of steroid injections, even though they can give you really good temporary relief. I would say 50% of my patients that have had injections, it did nothing. 10, 15, 20%, it gave them almost miraculous cure, but then the symptoms came back, and a small percentage, it actually, the condition went away completely. I don't know what to say other than if you have repeated steroid injections, it can cause degradation of tissue as well. I would say try everything else before you resort to steroid injections. Thanks for joining me. I do have, I don't know what's going on with my screen today. I do have some other upcoming webinars. Just go to our website for those that are listed. And I'm going to be doing one on diabetic neuropathy for the feet as well. It seems to be a common condition. I might be doing one on lymphedema for arm as well. I just haven't listed them yet. We also have a live in-person event. Look at that. In just north of Toronto at the Kingbridge Center, which I think is in King Township, so just a little north off Highway 400 in Toronto. If you want to learn more about BioFlex laser therapy, go to our website and you can sign up for that. I think it's pretty reasonable. It's a whole day event. It should be a lot of fun. We've got good guest speakers for that as well too. All right, let's see what questions you have for me. Andrea mentioned she's had a frozen shoulder on the right and started to develop the same symptoms 9 months ago on the left, and have been able to keep the inflammation and pain at a minimum and have almost full range through the use of BioFlex therapist system. It has been incredibly helpful. Andrea, your check is in the mail. I appreciate that very much. I'm not sure what we agreed upon, if it was $100 or $1,000. No, just kidding. I did not precipitate Andrea to say that. So, but I do really appreciate that, Andrea. Maybe you can write us a little testimonial, or I can even take that as a testimonial with your consent. That would be wonderful. Question from Florence, is there a difference in array placements with personal versus clinical units? Generally speaking, no. I would say they're pretty similar as far as what I would overhear today with the professional, but I do have webinars specifically on this topic, I believe, on the professional webinar, so you can revisit that as well. Another question is, on average, how long does it take to complete one treatment session? How long do you keep the pads on? That's a great question. If I put the pad on one spot, it's about 14 to 15 minutes, give or take. So 2 spots is 30 minutes and so on and so forth. When am I going to be doing a sports injury webinar? I was going to do a sports injury advanced training, but we're doing this other live event. So that's a good point. You know what? Let me think about that. And maybe that's going to be a whole bunch of conditions. So maybe I might do a series of sports injury webinars. That's a great idea. Thanks, Tracy. I might actually do that. I think that's it, unless you had questions in the chat box, which, by the way, I asked you to write in the Q&A, but if you want to make an appointment to come to us at BioFlex, just email myself, or you can go to our website. You'll see our contact phone number. You can give us a call. A question here, if you have consumer unit but never quite know what level is appropriate, as treatment times can vary so much and are hard to predict. I hope I answered that question today as far as how to use it. As far as what level is appropriate, I kind of walked through when to try these different levels. I do get the fact that sometimes certain levels seem to be better than other levels, and you kind of have to play around with that to some degree, but always start at 1 and then see how that goes. The problem where people come is, the issues is that they start to use it, and after 1 or 2 sessions, they go, this isn't working. Then they move to another session at the higher level and higher level very quickly. And that's not what I'm recommending. So, but Evelyn, if you still have questions or concerns or whatever, just give me an email and I can definitely help you out as well. Okay. I think that's it. Thanks everyone for joining me today. And hopefully I see you at the next webinar. Take care, everyone.